Diabetes is a growing epidemic affecting over 25 million Americans. And if this trend continues, as many as 1 in 3 will develop diabetes at some point during their lifetime. But the good news is weight management can make a big difference. So joining us today, the registered dietitian, Molly G.
Thank you so much for having me. It's really exciting what we know about diabetes today, and that small changes can really make a big difference.
Yeah, there's different types of diabetes. First, type 1 diabetes, usually diagnosed in children, maybe young adults, and that's when the body doesn't produce insulin. While type 2 diabetes tends to be more common in the older population, it's becoming more and more prevalent in young kids, even my young adult patients too, and that's a big problem. You know, that happens when the body doesn't produce enough insulin. Essentially, the body's ignoring the insulin. And what insulin is, it's a hormone that helps the body utilize glucose or sugar for energy.
Well, glucose is a simple sugar that's found in the carbohydrates in the foods that we eat. However, people with diabetes don't break down the glucose properly, and the excess amounts stay in the bloodstream.
You know, and if the high glucose levels are left untreated, serious health problems affecting your eyes, your heart, your kidneys, or nervous system can occur. And family history and excess weight are the top risk factors for developing diabetes. And we had a viewer reach out to us with questions about her type 2 diabetes. So we brought her here today to help address her concerns. Melvin Jean, thank you so much for joining us.
Well, thank you for having me. I've been a type 2 diabetic for 20 years or more now, and I know that I need to lose weight in order to reduce the risk of having complications due to diabetes. So I've tried to lose weight and not been successful. Maybe because I like fried chicken.
That's what we heard. Hopefully we're going to help you break that cycle.
And this is important because type 2
Indeed.
diabetes, the main part of managing that is losing weight, exercising, and keeping those blood sugars under control. Right. And the best way to do that, best way to lose weight, have a diet rich in fried chicken? No. Fruits, vegetables, whole grains. Because, you know, even if you just lost 5 to 10% of your body weight, it can make a huge difference in your diabetes.
Well, you know, I'm working on a National Institute of Health study, which really showed that people with diabetes, if they attended group classes, exercised, and used meal replacements, they had a sustained weight loss and improvement in their glucose levels. And Melvin Jean, weight loss is never easy, especially when you consider that people are so busy. In my work with Abbott and with my patients, I recommend using meal replacements like the new Glucerna Hunger Smart shakes and bars. Now, these were designed specifically for people with diabetes, but before you start in any dietary change, it's a good idea to check with your physician. Now, these shakes are an excellent source of protein to really help curb your appetite, your hunger, and they contain Carb Steady, which is a slowly digestible carbohydrate, which helps you to manage your glucose levels.
And that's good because not all carbs are the same. You know, some carbs are fast digesting carbs, like the ones found in orange juice. If you drink some orange juice, that sugar gets into your system very quickly. It causes a spike in your blood sugar, and that's not good. But if you eat more a slow digesting carb, then you don't get that spike in blood sugar. You get much more sustained energy levels, sustained blood sugar levels, and that's much more important.
But Melvin Jean, make sure that you talk to your doctor and find a dietary plan that works for you. So thanks for coming today. And Molly G, thanks for coming.
Thank you.
Great tips. And thank you, Dr. Sears.
You betcha.